And you all are here because you want to figure out how to find a Christian psychiatrist, a psychologist, or a therapist. And we'll even talk a little bit about the differences between those, because sometimes people confuse them or aren't 100% sure of what the difference is between a psychiatrist, a psychologist, or a therapist. And the disclaimer that I always give is that this presentation is to inform. We're not diagnosing, we're not treating. We'll talk a little bit about mental illness and what it looks like. And it's also not to establish a doctor-patient relationship. So a little bit about me in case we haven't met. My name is Dr. Tasha Jordan. I am a psychiatrist. I work in Camden, New Jersey. I had been working in Philly for the past 9 years. I've been a Christian for the majority of my life at this point. Went to Harvard for undergrad. I was at Penn for the past 9 years for med school, business school, and then residency. And in the past 2 to 3 years, maybe going closer to 4 years, God really has laid it on my heart that mental health and how mental health impacts the Christian community is where I would do a lot of my work. So I've been become a mental health first aid instructor and Christian Mental Health Initiative. We do a lot of work around mental health first aid. I've had the chance to speak about faith and mental health around the world, and I've started CMHI and have such a great team that I work with, and I'm excited to just have you all as a part of our organization. So today we're going to cover a few things, but I wanted to set the stage for why we're talking about how to find a Christian psychiatrist or psychologist before we hop into that. So a brief overview of the Christian Mental Health Initiative, brief mental health overview, mental illness treatment options, because we want to make sure we're differentiating mental health and mental illness, and then going into kind of really like a hands-on, we'll do practice of how to find a Christian psychiatrist or psychologist. And I'll be hopping between the slides and literally going to the internet. So bear with me as I'm sharing screen and wanting to make sure that you all can see everything. So first off, what is the Christian Mental Health Initiative? I'll be saying CMHI a lot because that's what we call it, the abbreviation for Christian Mental Health Initiative. We are a 501c3 nonprofit, and our simple aim is to increase mental health literacy of Christians around the world. So we want people to understand mental health, to understand mental illness, and really help to decrease the stigma about it, specifically within the church. And events like this are helpful. So maybe you don't see a stigma towards mental illness, but there may be others in your community who might. And we're hoping that the more we provide information, the more that stigma continues to come down and we can get more people into the care that they need. Our goals are pretty simple. We try to keep it simple because the clearer the goals, the more likely we are to actually achieve them. So first, we want to help Christians define and differentiate mental health and spiritual health, because that ends up kind of being one of the main issues where we feel like our spiritual health is having some sort of hindrance if we're experiencing mental health challenges, and that's really not the case at all. We offer mental health first aid training. So that's something we do about 3 to 4 times a year. And we're going to have some more trainings coming up later this year to get people trained in mental health first aid. We work with church leaders and members to identify resources for their communities. And then we provide faith-based mental health information and resources on our website, which is christianmentalhealthinitiative.org. So that's the focus right now. That's what we've been doing for the past year and a half, working with churches all over the country. Our events, we have been able to reach people all around the world, in fact, and it's really cool to kind of see the way we've touched them, whether it's through workshops about differentiating spiritual health and mental health, or workshops for church leaders where we're talking about mental health at the level that church leaders need to be aware of, or more about, anxiety and trauma as a Christian, or how about depression and dealing with that as a Christian. So these are just some examples of the types of workshops that we've had in addition to the one that you're at today. So hopping right into it, one of the basic tenets that we like to talk about is spiritual health versus mental health. And I basically will share this in probably any Christian Mental Health Initiative talk we do, because this difference is so important. So on the spiritual health side, we are thinking about, the sense of self that we have, our own sense of purpose, how we feel connected to God, others, and nature. So a practical example of that might be that I feel in this space that I'm continuing to grow when it comes to my spiritual health, that I'm understanding who I am in God, that God has put me here to be able to impact the church when it comes to mental health, that I'm reading the Bible, participating in Bible studies. I try to get out in nature as much as possible, although I have a foot injury that's kind of hindering that. But these types of things are the ways that I connect spiritually and my soul is renewed. But then on the mental health side of things, it's more specific. So it's thinking about our thoughts, our emotions, and the things that we do, and how that is all made up based on our biology, our brain cells, the places we're in, and the people who are around. So the thing is, spiritual health and mental health, they're related, because if my mental health isn't functioning well, if my thoughts are off, my emotions are off, or my behaviors are off, that may impact how I feel connected to God, to others, how I feel about my sense of purpose, or vice versa. If I'm feeling disconnected from God, that my spiritual health is struggling, that could impact my mental health, and my thoughts and my emotions and my behaviors can be impacted, but they're different. And that's really the main basis that we start off with, that it is possible to be spiritually healthy and experience mental illness, or you could be mentally healthy and be spiritually unwell. So that's something that I think is important, and I hope that we can kind of use that as our basis going forward. And then what's mental illness? So we talk a lot about mental health, and today is World Mental Health Awareness Day. And mental illness is the other side of that. It's kind of like a spectrum. When you're doing all the things that allow you to cope, that's when we're mentally healthy. But if our thoughts and our emotions and our behaviors are leading to distress, or we're having difficulty in functioning on the day-to-day, that's when we're approaching either mental health challenge or mental illness. So mental health, or mental illness rather, at a glance. 1 in 5 people, so 20% of people in the United States, experience a mental illness at some point. So in our group right now, we have a group of 20 people. So this is saying that 1 in 5, so 4 people roughly, could be a little bit more, could be a little less, in this group alone, have at some point experienced a mental illness. And we're Christians, I think. A lot of the people, I'm assuming, have joined because you're Christian, wanting to learn more. And we're not any different. And you're also not alone. And I think that's one of the things that we want to make sure that we're emphasizing. Here's some other data that are important to know about. So that 20%, when you look at it from a numbers perspective, is nearly 50 million people. So, and that's just in America. So nearly 15 million people have experienced mental illness. And the commonality of this, we want to think of it like we think of diabetes or high blood pressure, or someone experiencing gout. It's an illness. It's something that happens that also is treatable, and it impacts a lot of people. It's not to say that you're spiritually doing anything wrong, but you're a human being who has a brain that's susceptible to all of the things that are going on around us. Something else to consider. So about 4 to 5% of adults have reported serious thoughts of suicide, and this has increased every year since 2011. And that increase is even more when we're looking at the numbers for children. And I hope that you all are aware of, and if not, I'll share 988 is the new number that's been rolled out by the government, which is to be kind of like the 911 equivalent, but specifically for mental health, where suicidal thoughts is one of the examples of a crisis and a reason why someone might call 988. Here, 15% of youth have experienced major depressive episodes, and that number also just keeps rising. So it's all over the place. And 25% of people with mental illnesses have not gotten the treatment they need. So that's where today comes in, that we're going to show you how to get that treatment. And this number is not declining. If anything, this number is getting bigger year after year of how many people aren't getting the help that they need. Some more numbers to look at. So over 10%, so roughly about 10% of youth have had severe major depression. So that's a little different than the number before, where I said it was 15% have had a depressive episode. Now we're looking at severe. That's 1 in 10 of our youth. And then the highest rate was someone who identified more than one race. And in particular, we're looking at minorities in general, especially young children, are experiencing even higher increases in suicide rates. So these are the types of things that are happening in the church. It's not just, other communities outside the 4 walls of the church, outside the body of Christ. It's also happening in the church. And then this kind of goes on to what I said, but more than half do not receive any treatment at all. So some people are getting treatment that doesn't meet their needs, and some are getting no treatment at all. And this mental illness does not just impact the person who's experiencing it. You know, if any of you have experienced having a family member who has had a terminal illness, whether that's something like Alzheimer's or cancer, you know that it impacts the whole system. It impacts the family, it impacts friends, it impacts the church community. Mental illness is the same. The challenges that a person with mental illness has does not affect just them, but it impacts those who are in community with that person. So why should we care? Why should we as Christians care about mental illness? It's common. We talked about some of the numbers. Church leaders, so like Pastor Hester, who's in the chat, church leaders are frontline spiritual caregivers for people of faith. So we know that part, but they're also frontline mental health caregivers. So people are more likely to go to a pastor, to a ministry leader, than they are to come to me, than they are to go to a primary care doctor or a therapist. So that's one of the main reasons that Christians should care about it, because it's happening and they're going to the church leaders. But the issue is that the church leaders and other church members don't have mental health training. So that's part of why CMHI, we offer mental health first aid training, and why we have workshops like this to help just provide more information to the folks who are honestly doing a lot of the on the ground work already. And something I have to emphasize, we cannot just pray away mental illness. The same way we would not just pray for someone's high blood pressure to improve, we may pray and encourage them to go to the doctor. And that is 100%, to me, something I agree with. And the same way that I would pray if someone's experiencing depression or anxiety or psychosis, I would pray to God for their wellness, knowing that He is our greatest physician. But He also has given us the resources of medication and therapy that we'll talk about. And I can't see which side it's on, but whichever side, the little logo, one of our mottos as CMHI, it's faith, meds, and therapy. We think that's the trifecta, and research has shown, and truthfully, we've even done Bible studies that have shown that the combination of faith, medication, and therapy really is a great combination to address mental illness. So before we even get into the idea of how to find these providers, we need to know why you would even want a therapist, or why would you want a psychiatrist, or why would you want a psychologist? And I'll talk again about how those are all different. But, you know, these are some of the red flags that might come up as to why someone might need help, and because they may be having a mental illness. And the biggest thing here is when you notice a recognizable change in someone that's impacting how they're functioning on the day-to-day. So we have cognition, which is how someone is understanding a situation, their memory, their thoughts, their mood. Are they more reactive? Are they sad? Are they too happy? And you're like, wait, why are you so happy? Any kind of change in their mood that's impacting their functioning, those are things for us to keep an eye on. Speech is another one. How fast someone talks. I tend to talk super fast. How fluid their speech is, the types of language that they're using. These are the types of things that we can pay attention to as people living in community with one another and caring for one another. How someone thinks. So ideally, we want to make sure that when we're having conversations with people, we feel like they're having rational thoughts, and that they're not, you know, kind of breaking away from reality and trying to convince you that grass is red when we know that grass is green, or other things like that that we just know aren't based in reality. How people look is another big one. So are they caring for themselves in the same way? Is their hygiene on point? Are they dressing right for the season, or just appropriately in general? These are some of the things that you might see. If you see a change in someone experiencing this, it might make you think, is something going on with their mental health? And it's not your role, unless you happen to be a provider, it's not your role to diagnose. It's your role to care, and your role to be able to say, hey, I'm noticing that something's going on, and maybe it might be helpful for you to see someone. Do you want some help trying to find a provider? And in this case, we'll talk specifically about Christian providers, although some of the tips that I'll share can be applicable kind of across the spectrum. So let's talk about faith, meds, and therapy. We're going to go into this briefly before I go to the different tips that I have. But medication, a medication for psychiatry, there are tons of different types. This slide isn't really for you to know the differences between antidepressants or antipsychotics, but more so to show that there are a lot of different options of medications. And in a couple of slides, you'll see who is the one that will be providing the medication. And then therapy, it's when you have the chance to talk. You get to talk with someone, and there's so many different styles of therapy. I've just put 3 on the slide just to give some examples, but it can be supportive psychotherapy, where that one's really more of like your quote unquote talk therapy, where you just go to talk to someone and they hear you out and they give you some support through a challenge. Cognitive behavioral therapy is a little bit more specific. You get homework. So these are for the people who are okay with having some more structure. You get homework and assignments to work on during the week that you then follow up with your therapist on the next session. And family therapy is another type that you can have. But again, I could never in a talk like this go through every single type of therapy because there are just honestly so many. But here we go. We're talking about the 3 different main types of providers. There are others, but I'm using kind of like the most commonly used terminology. So one of the things that I think is important is to recognize, and you'll see here, that a psychologist and a therapist are not the same thing. These terms get used interchangeably a lot, but there's a difference, and we'll talk about that in a moment. So the first column here is a psychiatrist, which is me. I'm a psychiatrist where psychiatrists are able to prescribe medication. So those medications I talked about before, the antidepressants, the medication for anxiety or psychosis or for bipolar disorder or whatever have you, a psychiatrist can prescribe those. And then a psychiatrist can also do therapy. So in my residency training, I got trained to do therapy, and I love doing therapy. Not all psychiatrists do therapy, but some do. And I love the opportunity to be able to do both, to provide medications when they're needed, to provide therapy when it's needed, or do both if both would be helpful. And the training here is that a psychiatrist goes to college, they go to medical school, and then they go to residency training. And then I could have added also fellowship, which is more training. A psychologist does just therapy, and I'll keep this simple for now because there are a lot of laws actually going into place where because of access issues, they're starting to provide prescribing privileges to people like psychologists or therapists or even some nurses. But we'll keep it simple and say that generally and historically, psychologists are just doing therapy. And they go to college, they get a doctoral degree. So that can be either a PhD or a doctorate of psychology. So there are 2 different types of doctoral degrees that they have. Then they do 1 year of training when they're working underneath a more senior psychologist after they've done their degree. And then therapist, that's kind of like a catch-all category where it's a psychologist technically can be a therapist, but a therapist is not the same as a psychologist. So therapist is anyone who provides therapy, but specifically, typically what this means is they've gone to college, they have a master's degree of some sort. And here I gave examples. It looks like a bunch of random letters, but you can have a licensed clinical social worker, you can have a psychiatric mental health nurse practitioner, and I'll put a little star asterisk, they can prescribe medications as well. MHC is a mental health counselor, and then there are other types of providers, but those are kind of like the main ones. So typically when I am suggesting that people look for a provider, this is who I'm suggesting. You may also have heard of a mental health coach, and I don't know if anyone here is a mental health coach, so I'm not bashing mental health coaches, but I think the training for mental health coaches is so diverse. It's already diverse, to be honest, for therapists and for psychologists and psychiatrists, but for mental health coaching, the level of training that you need can vary greatly, that sometimes it's hard for me to be able to suggest that someone go see a mental health coach, just because it's harder to kind of verify exactly what their training is. And I wouldn't want to suggest that people just like go talk to anyone who maybe doesn't have specific training in mental health or mental illness. So typically I'm encouraging people when they're looking online or they're finding websites that you're looking specifically for someone with any of these letters, that you're looking to see maybe if they have a medical degree, MD or DO, those are both doctors, the psychologist with their PhD or PsyD, the LCSW. There's some other ones that I didn't put on here, like a licensed marriage and family therapist, but like you're looking for someone ideally, truthfully, with at least a master's level of training, because with those programs, you're more likely to have specific curriculum that the person has to go through, so you know they're getting adequate training in mental health and mental illness and the type of therapy that they're going to be doing with you, which honestly to me is incredibly important. You don't want to be just like going to any and everyone, because training can be very different. So we're hopping into it now. So I'm going to kind of walk through these different examples going one by one. I want to drop, I would love for everyone here. So just put a 1 in the chat if you've ever looked at the back of your insurance card and seen this behavioral health option on the card. So go ahead and drop a 1 in the chat if you have, or a 0 in the chat if you haven't. Okay, so I'm seeing some zeros, a 1. It's a mix. So some people have, some people haven't. So what I'm going through, and I'm glad, because I want to kind of get a sense of what people are aware of versus what folks are not aware of. These are really, some of them, they might seem straightforward, but I wanted to put it all together because it's resources that people may not know about. So on the back of your insurance card, this is not my insurance card, I just kind of found this picture off the internet, but just about every insurance card on the back of it should have something like this. And it might have different language. It might say mental health, behavioral health, but something related to mental health on the back, where there's a specific phone number that you can call. And when you call that number, the person has to, whoever answers, it's their responsibility to connect you with providers. So when I've done this in the past personally, I call the number on the back, and typically what they'll do is they'll provide you with a list anywhere from 3 to 5 providers who take your insurance, because in this case, we're looking for someone who will take your insurance and you don't have to pay more out of pocket. And you are allowed to ask if any of the providers who are in their insurance network identify as Christian, or if they specify that they see people who want to incorporate their faith into their mental health care. So that's something. And you're allowed to ask other questions, like if you want a minority or if you want a woman, they're way, like they may try to tell you they can't, but they can. They're allowed to do that. They are supposed to do that if you ask for it. And then depending on how your insurance works, they'll either send you an email with a list of people, or they'll provide it to you over the phone. So you have to be prepared to just like write down the names and numbers to be able to call to find the provider who, in this case, takes your insurance and identifies as Christian. So this is step 1. And before we go on, I want to leave space for questions, and I'm going to just let questions go through for each of these. So if anyone has questions, you can drop it in the chat, or come off of mute, whichever. We're a small enough group that it works to come off of mute if you have questions. So I'll pause for a moment, but then keep going if there are no questions.
I have a question. Yeah, so I'm looking at the back of my insurance card, and I don't know if it's different for student health insurance, but I guess like I have like UHC student insurance. If I can't find the number on the back of the card, would it be like on the website or something where I could find it?
Thanks for asking. So if it's not the back of the card here, for instance, where it just says like member services, then I would say call the generic member services number so that they can then give you the behavioral health number. It's annoying in a sense that they're making you kind of jump through those hoops. Something else to consider if you're a student is that what may happen sometimes is they may want you to use whichever like hospital system you're working at, or whichever hospital is associated with your school, they may want you to use their specific mental health program. So you may have to look to see if there's like a different mental health program specific with your school. But if all else fails, the generic member services number should be able to direct you to the right mental health number.
Thank you.
You're welcome. And yeah, that's a good point, because I did have to find a random picture on the internet that had the behavioral health number, because not all of them had it on the back, but this is one of the places that you can look. So if we go to the next option, and there's 7 of them that I'm going to walk us through. So asking your network, this one it can seem like, I don't know, and I don't want to, like, I don't know how else to say this other than it could seem obvious, but it actually can be so powerful. So when it comes to your network, first, that's a step to be able to destigmatize mental illness in your own community, to be able to have those open conversations. When I was looking for a therapist, this was about 2 years ago, I was looking for a therapist and I was kind of going through some of these steps, and I reached out to people I knew, and some of them I knew were in therapy, some I didn't, but I was like, hey, I'm looking for a therapist, preferably a Black woman who is Christian. Do you have any recommendations? And that's how I ended up finding my therapist, actually, was just kind of through word of mouth, that someone I knew had recommended her, and then she had openings and she took my insurance, praise the Lord. And that worked out very well. And then I know that about 3 or 4 of my colleagues and friends now also see that same woman, because they were asking for a provider, a therapist, and I gave them the information from my therapist. So I would say definitely use your network. I'm sure, because we talked about those statistics, that about 20% of people are experiencing mental illness. There are people you know who are in treatment. So just being able to ask the question, you can find possibly a Christian in particular, because if you're asking in the church, or you're asking a friend who you know is Christian, that's a really great way to be able to find a provider through your own network. And I'm going to just keep going, but feel free to stop me if questions pop up. So the next one, again, like, these things can be really basic seeming, but I put these in quotes because this is exactly what I would want you to Google, and use the quotes as well. Because what this ends up doing, it's when you put quotations in your Google search, it allows the algorithm to look specifically for those words in that order on their whole database on the internet. So these are things that I have tried for myself or for friends or for family when they were looking for a mental health provider. Literally, I just put Christian psychiatrist near me. And then usually it'll come up with like a list of people, also on Google Maps. So usually what comes up is on Google Maps, there's a list of providers and they show where they're located in relation to like wherever you have on the map. Christian therapist near me, Christian psychologist near me. So these are literally things that you can search. And again, like, sometimes I'm like, oh, this may seem like super basic, but if you haven't tried it, like, try that. Literally putting into Google, in quotes, Christian psychiatrist, Christian therapist, Christian psychologist near me, and see what comes up. So that's one option. And then the next ones I'm gonna go over are a little bit more detailed. So betterhelp.com. This, I've heard in the news that their reviews from the provider side, maybe they're not like the best employer, is what I've heard. And we have, like, CMHI and myself personally have no affiliation with them. But I will say this, I know personally many friends who have found good Christian therapists on betterhelp.com. Even some of my patients have found good therapists, and that's even who aren't Christian, but therapists in general on betterhelp.com. My understanding is that they do not take insurance, but their fees are a low flat rate that you can see people virtually or in person. And what I did here was I showed a screenshot where they have a really, if you go to their website, betterhelp.com, they have a really nice intake questionnaire, basically. So right on their main page, you go through the questionnaire of what type of therapy are you looking for. They ask questions about, what symptoms are you having? Do you want a Christian type therapist? Or if you were of a different faith, they ask about other faiths as well, or none. And they're able to match you up with a few people who could work for you on the basis of what you're looking for, if you want a woman, if you want a minority. And so I thought it was kind of cool that betterhelp.com has that questionnaire built in so that you can get a specific match as possible. And I recommend this one, honestly, just on the anecdotal basis that I've had several friends and patients find good matches. And when I say good match, a therapist or a psychologist who actually help them get better on this website. So if you haven't heard of betterhelp.com, here it is. And I'll kind of do the same thing again. If you have heard of betterhelp.com before, you can drop a Y in the chat. If you hadn't heard of it before, you can drop an N in the chat. And that's Y for yes and for no. Okay, so I'm seeing some yeses, nos, maybe a few more yeses here than the insurance card. So that's helpful because maybe they have really good advertisements. I think I think I've actually seen ads for them on TV, and I watch YouTube a lot, and they have like this video sponsored by BetterHelp. So maybe that's why they have good advertising. But okay, so that's helpful for me to know that some of you have heard of BetterHelp before. So what I'll go on to next, the next research. So psychologytoday.com. This is another very helpful. Winsome says that I've referred patients to them. Yeah, I honestly have found it to be really helpful. And because one of the issues that happens is not only do you need to find a Christian mental health provider, but then you have to find one who's taking patients where the wait list isn't like 6 months long. And typically when people go on betterhelp.com, because they have thousands of therapists on there, I haven't heard anyone waiting more than a few weeks. So that's where BetterHelp, and maybe I'll go back to the BetterHelp slide, but that's where BetterHelp has been helpful. I've seen that people can get in pretty quickly. So the next one, Psychology Today. So we're actually going to move over to the website. So let me open this up. I know you're seeing all my screen, but I wanted you to be able to see this all at once. So what I think is cool about psychologytoday.com, it's a really cool search engine, and you can specify it, or how do I say, you can make your criteria very specific. So if someone can drop in the chat what your zip code is, any zip code, and we'll just like pretend that we're looking for a therapist in your area. So I want someone to drop a zip code for me in the chat. Okay, so we have 37209, and we're going to use these other zip codes going forward because I have some other websites that I want to show you. So, all right, so this is Nashville. So the first thing that we do, right? So going into this, we're just looking at therapists. So a couple of things I want you to see. So here in this drop down, you can change that to, do you want it specifically online? Do you want it to be a psychiatrist? And remember, I said before that a psychiatrist can do therapy and medication, but more likely than not, the psychiatrist is going to do just meds. Treatment centers, support groups. So you can look for a bunch of different types of providers, but we'll keep it as just therapists for now. And then here, this bar in the top is where you can get really specific, which I think is cool. And I have used this for myself as well, because I'm currently looking for a new therapist / psychologist. So I've been looking here to find someone for myself. So you can kind of, if you're looking for a specific issue, for instance, you can put in that information here, but we're going to leave that blank for now. Here, you can look to see if they actually take your insurance. I think I have Blue Cross, so let's pretend, yeah, we'll just look at Blue Cross in the Nashville area. Types of therapy. So if you knew like there's a specific type of therapy that you wanted to do, Psychology Today is cool because you can go in and put in that specific type of therapy that you want. And this is for you, not for the provider. We're not going to have a toddler therapist, but this is for who needs the help. We also have pricing, where you can look here to see, what exactly is the price. Do they offer sliding scale, which is based on your income? And then they kind of give you categories of what are the buckets of how much the price costs. But when we look here at the more category, this is where I think oftentimes people don't look, and I find this super helpful. So I've mentioned already that I prefer a Black provider, and I've only ever had Black ones, so I don't know. I just prefer it. So let's say we're looking for, okay, so they're none. So there we go. So there are none in this zip code. So we'll undo that. That's probably, well, that's weird. Oh, maybe she just didn't list herself as Black. But let's say if we want to look for Christian. So here, now they're saying that they're none. So it says, try removing some filters or search instead for a matching teletherapist in Tennessee. So let's look for online therapy, or I guess we can click on this link. So this is where there are options for teletherapy. And these are people who take that insurance and who also are Christian. So maybe if I go back, for instance, and I'm showing you this because I really want you to see how you can play around with this search engine. So we want to keep it as Christian, but I want to go back and take out that insurance bit. How do I do that? Oh, okay. So we're going to go back to 37209. And so we're not going to look at the specific insurance for now, but we're going to look at just Christian. So here we see a list of different Christian providers. And as I mentioned before, some of the things that you want to look at is what's their training. So Kelly here, she's a licensed, she has a LM. I don't know what the L, maybe that's a master's, but either way, the SW is social worker. Yeah, I don't know what the M is for. License something, but she's a clinical social worker. So you know that she has a master's level of care here, or a master's level of training. There's some more so licensed clinical social worker. She has a master's in social work. Looking to see if we have some medical assistants with the MA. We have Dr. Hunter, he's a PhD. So these are the types of things that you want to look at. I had mentioned before the licensed marriage and family therapist. So that's what the LMFT is for. Looking at the different types of training that folks have in addition to, them being Christian, or, identifying in the race or ethnicity or any other demographic that you find to be important. So I wanted to walk through this because I think a lot of times, especially on Psychology Today, which I find to be a very powerful tool to search, insurance, cost, where they're located, gender, all of these different types of things. They have a lot of filters basically in that point. So I'm curious if anyone, oh, thank you, licensed mastered social worker. I figured it had something to do with a master's, but I wasn't 100% sure what that was. So thank you. But are there any questions about this, or thoughts? I saw Nanetta said, wow, she hadn't seen this before, but I wonder if anyone has questions or thoughts before we go on to the next resource. And again, we're a small group if anyone wants to come off of mute. Okay. All right. So I'm going to copy Nairi's, her zip code. Oop, I saw a new message. Okay, this is helpful. I'm glad it's helpful. Because I think one of my things was I was afraid. I was like, I hope people aren't insulted. But I was like, I want to keep it simple and like actually practical. So going back to the slide real quick. So now we'll go to the next resource. So this is another one. I can't remember how I found this. Yeah, I honestly can't remember how I found this, but this next resource, christiancounselordirectory.com. So we'll similarly go and use this one. It's a little bit different than Psychology Today, which is why I want to walk through it. So we're going to drop in the 08009 zip code. And one of the things that I want to just kind of emphasize to start off with is this is Christian Counselor Directory. So I didn't add counselor into that table I showed you where I did psychiatrist, psychologist, therapist. I could have added counselor, and maybe I'll update that for the next time, anytime I do this presentation again. But a counselor is also not a very specific term. In the same way that a therapist isn't a specific term, people can have many different types of training to get you to the point of being a therapist. That's very similar for counseling. Because, for instance, you may be familiar with, maybe at your church, the pastor or a ministry leader or an elder or deacon or whomever, they may provide Christian counseling. And some people honestly don't really have any training in it. They just are spiritual, and they provide you biblical guidance. And literally that word counsel is to give that guidance based on their biblical knowledge. But that counseling term really can vary in terms of what it offers. So I say that as a caveat, because in the same way that before I said, preferentially, I tend to like when people have specific training for mental illness or for mental health. But at the same time, as I went through this resource, a lot of the people on here, even though their practices are listed as counseling, many of them actually do have bona fide clinical training in mental health or mental illness. So here, this one, what's interesting, so they can give, in this database, you can search based on distance, for instance. So here, I put in within 5 miles of 08009. It seems like they're the closest to that is this Restoration Hope Counseling Services, which is 9 miles away from that zip code in Jersey. And let's see. So if we go to Restoration Hope Counseling Services, LLC, you're able to kind of look through here. So Elizabeth, she is a licensed mental health counselor. So that falls into that therapy bucket that I had talked about before. So she does have that formal training. So these are the types of things that you want to look through, that you're finding someone who has formal mental health training, even if they're offering counseling services. And here it says she has specific education in integrating Christian values and beliefs with professional mental health care. And I'm like, that's perfect. That's literally why y'all are here. That's why I tried the type of work I'm trying to do. And this website, I found it to be a pretty great resource. They have, I want to say thousands, honestly. I hope that's not an over exaggeration, but they have a lot of different faith-based providers on this website. And again, it's christiancounselordirectory.com. And their Find a Therapist website. So they don't have the same filters that Psychology Today has. I think someone came off of mute, but they don't have the same filters. But because this is already, the providers on here have self-selected as Christian, you kind of skip that step of having to filter for the Christian as you would have to do on Psychology Today. So Marilyn has a question, and she says, is it acceptable or advisable to ask a prospective provider if he or she identifies as LGBTQ, or about the views in counsel? Oh, wait, hold on, there's an emoji blocking. Or about I think their views in counseling, especially children. You know, it's an interesting question. No one's asked me that before. Let me think about it. So I'm not sure. I'm curious for the other, because I think there are a couple of other providers or folks in the chat, what their thoughts are on this. Because I think it could be considered like an invasive question to ask. And at the end of the day, also part of mental health training is when someone is asking those types of questions, sometimes the provider will not answer you or like dodge the question. But I guess it may depend on, in part, why you're asking the question. You know, maybe it's less about if that person in particular identifies as LGBTQ and what that may mean to you, and more so about how that could impact the therapy they provide. Or so a question that may be a little bit more neutral could be, you know, what are your thoughts on, sorry, I just got distracted by Nana's message, but like, what are your thoughts on LGBTQ issues? Because that may be something that is important for you to know about your therapist. But it could be seen as invasive to like point blank ask them their own identities, whether that's from like a gender or sexuality perspective. And Nanette is correct that definitely some providers pages will say that they are LGBTQ friendly, or in other ways identify that they are inclusive or welcoming of people who identify as LGBTQ plus. I have also seen that people will self-identify as LGBTQ plus on their websites. But I really just have never thought about just outright asking someone, because I guess for me, the things that matter I can like see if you're Black, or I can see if you're a woman. So yeah, I don't have a specific answer for you on that, but I think understanding what their views are in the therapy space is probably the most important thing when it comes to that question, and how that may impact your comfort level with the provider, and if the provider kind of aligns with your goals in therapy. But good question, and something that I could maybe do a little bit more reading into and thinking about myself. All right, so I'll keep an eye on the chat to see if any other questions pop up. But let's go back to the PowerPoint real quick, and we'll go to, this is the last resource that we'll talk about. So the Christian Mental Health Initiative.org. So our website, the mental health resources page just got a revamp, which I'm excited about. We haven't announced it yet. That's going to get announced soon. But we went through a revamp, and basically we already had this website, but we wanted to make it, or this web in particular, make it a little bit more user-friendly. So a couple of things that you'll find here. So these buttons can help you navigate to the different sections. But here, looking for Christian mental health care providers, we have some resources on here, some of the ones that I talked about in today's session. So like BetterHelp, Psychology Today, this recovery village in Columbus, Ohio. Pathways to Promise is one based in Philadelphia. The Hope Center is based in New York. Postpartum Support International has some connections there where there are faith-based groups for people experiencing postpartum depression or psychosis or loss of children. These are different resources that are available, and this is going to be an ever-evolving website, so I would encourage you, that you can keep checking in on this page for additional websites. Like, for instance, we should probably add this one on here, the Christian Counselor Directory. We'll probably add that onto this section in a bit. And then we also have some like examples of resources specific to Philadelphia, like Access Services, Hope Center, again, or this one's like Philadelphia area. Transformation to Recovery is another Philly-based one. So our website's here, and then just to kind of walk you through some of the other resources on the website. So we have a lot of general information about mental health. This is a government-run treatment locator. So if you're not so tied on or set on having a Christian provider, this one, the treatment locator, this will kind of open you up to way more facilities for mental health and substance use around the country. So the website that we have here is really robust, honestly, and the volunteers have done an amazing job at putting this together. There are different apps that you can use. There are resources specifically for church leaders. If you're a social media person, so there are YouTube videos, podcasts about faith and mental health, Instagram pages or blog posts if you are someone who likes to follow on Instagram. And then lastly, we also have some books and versions of the Bible or devotionals that are particularly helpful when you're thinking about that faith and mental health intersection. So I just wanted to kind of share the mental health resources page for Christian Mental Health Initiative, because we've recently revamped it. Our designer did a really great job, I think, of making the site just easier to navigate and to be able to see all of the resources that we have here on the page. So the last thing I wanted to share before we wrap up, it's that if you're interested in connecting with us, we would love to have you. I feel like every time we have one of these sessions and these workshops, we kind of get some more volunteers added onto our team. So as I mentioned, Leonata, who is with us, she is one of our volunteers, but we have this really wonderful group who has helped us with the blog posts that you see on the website, which are great, and you should read them if you have not. They're honestly really good blog posts. The resources that were compiled for the mental health resources page, they help with events, they're helping with grant fundraising. Honestly, the volunteer team, I am so grateful for them each and every day. We also have community collaborators. So Cassandra Ogberry, she is a representative of a church here in Philadelphia, and we work with her and her church on an ongoing basis, having events about 2 to 3 times per year with her church that are specific about mental health and how it relates to the church community. So if you're interested in either of these, being a volunteer with us, or even being a community collaborator where you establish a formal relationship between CMHI and your church, feel free to reach out at the info@christianmentalhealthinitiative.org. And I'll also be sending some follow-up emails after today's session. And honestly, everyone, thank you so much for joining us this evening. And I hope that, and I ask that you not keep this information to yourselves, but that you share it, that you disseminate this information to anyone who you think may benefit. Because at the end of the day, we as the church, we are, part of the body, and we have to be strong together. So the more we can share this information, the more we can get people the help they need, the more we can help to just create mental wholeness to support the spiritual wholeness that we're seeking as Christians. So with that, thank you all so much for joining, and looking forward to joining you at our next event.